So this next video I'm going to be showing a functional exam for the hip joint, and that includes looking at posture, any Trendelenburg signs, and single and double leg squat. So first for posture, I'm just going to get a posterior view of the patient, so go ahead and turn the other way. And with this, I'll be checking for any sort of asymmetry, so I'll be palpating the iliac crests, moving posteriorly to feel along the PSISs, which, tender. And then I can move along anteriorly, feel for the ASISs, tenderness there. And I can just check for any inequalities with whether one hip's higher than the other. And I can also check for any sort of valgus or varus collapse at the knees. So go ahead and face the clock. Now from a lateral view, I can get a better idea of how his plumb line looks, if there's any thoracic kyphosis or excessive lumbar lordosis, any excessive knee bending, any extra hip flexion, and he'd look something like this. And I can also get an idea of maybe some cervical and shoulder range of posture. So next, looking at Trendelenburg, I'm going to have the patient face the TV again, and then raise one leg up, like you're marching in place. And what I'm looking for is any contralateral pelvic hip drop, which would be a positive Trendelenburg sign. So if I can pull his shirt up a little bit, go ahead and do it again. See, he's losing, I got you. You see he's losing balance, which would probably be weakness of muscles. Go ahead and flip to the other side.
Yes, we have it.
I can see that contralateral pelvic drop, so that would be a positive left Trendelenburg sign. Next up, for double leg squat and single leg squat, go ahead and face the clock for me. And I just want you to do a squat like you normally would. Go ahead and do it again. So we're seeing a bunch of excessive knee flexion, so this would be a quadriceps dominant flexion. What we're really looking for is making sure those knees do not go over the toes, and checking for any, and making sure it's more of a hip dominant flexor over a knee dominant flexor. And then go ahead and stand on one leg and go ahead and do a squat for me. And keep you. And now we're really seeing some excessive knee bend. Go ahead and do it again. So again, could be weakness of the hips, could be tightness of the quads, or it could just be a poor hip joint. So those are the functional tests for posture, Trendelenburg, and then double single leg squat.